Namaste. A very warm welcome to all of you who have joined this very important global media briefing ahead of the fifth high-level ministerial meeting on antimicrobial resistance, or AMR as we call it, which would be held in Nigeria. This is the very first time that the global ministerial meeting on AMR is being held on the African soil. A few quick housekeeping announcements before we begin. Participants, please type in your questions in the chat box, even as the speakers present. Only those questions would be taken up that are relevant to the topic of today's global media briefing and as much as time permits, after all the speakers have presented. Friends, we all know that AMR continues to be among the top 10 global health threats, and it also threatens our food security and our environment. All of us are at risk of AMR, but those in low and middle income countries, and especially those who are underserved, are at a much heightened risk of it. We have to do better in protecting the medicines that save us. We also have to do better in saving lives from preventable infections, as well as ensuring right and timely diagnosis and right treatment, care, and support for everyone, leaving no one behind in the true sense. Without any further ado, I would now like to invite my mentor and guide, Dr. Jean-Pierre Niamazi, Director of the Quadripartite Joint Secretariat on AMR. Over to you, Dr. Niamazi.
Thank you so much, Shoba, and a really huge thanks to you and your team and the Global Media Alliance as well for your continued efforts and partnership to make sure that the media and AMR really gets to be understood and to be by all the citizens. So it's really, we thank you for your continuous support on this front. On behalf of the Quadripartite Joint Secretariat, as you know, we are constituted by FAO, UNEP, WHO, and the World Organization for Animal Health. So I'm pleased to be here today and to meet with you, the media, and our partners as well who were able to join today. But most importantly, with you, Yodi, and the Nigeria officials as we look forward to come to Abuja and to have these important discussions on how we could continue to addressing AMR. So I think Shoba said it, AMR is a big threat and it continues to kill many people, and especially in the LMICs, in the low and middle income countries and in the global south. And it's also going to be the first time that the Ministerial is hosted on the African soil. So it's a very important opportunity to have the countries such as Nigeria to lead this effort. Now, why is this really matters? To me, the fifth high-level ministerial conference is a key moment to carry forward the momentum from the UN General Assembly high-level meeting on AMR in 2024. We discussed this with the media previously, and as well to translate the political commitments made there into country-level delivery. It also builds on the outcomes of the fourth global high-level ministerial conference that was hosted by the Kingdom of Saudi Arabia, which also came up to gender commitments. I think the task, and we'll hear more from Yodi and the group and the team, the task for this upcoming ministerial conference will really be about enabling the acceleration of implementation of multi-sectoral national action plans, enabled by an effective governance at all levels and sustainable investment under the theme of One Health, advancing global AMR commitments through local action. The media is a strategic partner to inform, connect, to hold us accountable. So evidence-based reporting keeps AMR visible as a development and equity and sustainability issue. It shapes the public understanding, support, behavior change, and sustains pressure for measurable progress. That's why today I think it's important that we address you, the media, and we give you more information so that the narrative that continue to be written about AMR and the upcoming ministerial conference is going to be building a strong momentum for both the attendance, but most importantly, for the action that is going to come out from this meeting. So without taking much time, I think today is for mainly our Nigerian officials to address most of the questions and give you most important information that you may need today. Shoba, back to you. Thank you.
Thank you very much, Dr. Niamazi. And thank you for your kind words for Gamma. We are trying to do our two little bits, that's all, under your guidance. Friends, all of us must be so wanting to learn more about the upcoming 5th high-level ministerial meeting on AMR in Nigeria. Hold your breath. The moment has come to invite high-level officials from the government of Nigeria to tell us more. It is my great honor to invite Dr. Yodi Alakija, Ministerial Global Envoy on AMR, Government of Nigeria, to speak. Welcome, Dr. Alakija.
Thank you very much, Shoba, and thank you so much to my dear brother, Jean-Pierre Niamazi. Greetings, good morning, good afternoon, good evening, wherever you all are in the world. It's an absolute honor and a pleasure to be here with you all today. Really everything has been said by way of introduction to talk about the core of the conference, but I want to touch on a couple of points. This is going to be an informal meeting. This is a briefing. I'm not making big speeches, and you're going to learn that Abuja is also not going to be about big speeches. Abuja is going to be like the theme says, it's going to be about action. But, you know, Jean-Pierre just said that media is a strategic partner. And right from the outset, I want to tell you that you're not just a strategic partner. You're a key partner. You are critical in the processes, all of our global health and development processes. The media is critical. You will remember during COVID, it was really the media that kept the world accountable. It was all of you, and I want to thank all of you for that. During COVID, I served as the WHO Special Envoy for the ACT Accelerator and chaired that group that dealt with vaccines, diagnostics, and therapeutics and how we would get them to the whole world. If it wasn't for the media, if it hadn't been for the BBC interview that I did in those days and the CNN interviews with Amanpour and others, if it had not been for the media, the world would have been flying blind. If it had not been for the media, Africa would have been shut out as many countries started to put up unnecessary and frankly illegal travel bans at the time. So media is not just a strategic partner, you are the partner. You are one of the most important parts of this conference, and this is why I really wanted to be here in person today to speak to you all. I want to thank Gamma and Shoba. Thank you very much for your kind welcome and introduction. Thank you to the Quadripartite group for putting this together. You will keep us accountable as a global community, but you're also critical for awareness, and you're critical for keeping the communities that we serve involved and keeping them understanding what exactly is AMR. Because that would be my first question to many of you. What is AMR? If somebody were to ask you, if you were to be writing a byline, a little piece tomorrow, what is AMR? And most people around the world don't know this. Most people in our local communities, Shoba, you mentioned very well, our high burden countries, our underserved people. Most people don't understand that you can go to hospital and you can catch an infection and you could potentially die having gone there to get a treatment. But also when we talk about AMR in the context of One Health, I think too many people think about it in terms of human health. And it is not just about human health. You know, it is about protecting not just our medicines, as Shoba said earlier, but it's also about prevention and protecting our animals and protecting our environment to ensure that this planet that we have been so awesomely handed as guardianship and stewardship of, in ensuring that this planet is taken care of and that we are not harmed. And so also the animals and the plants and the agri-food systems around us are also kept safe so that we can all live in harmony together. This conference is about local action. You have seen the website has just been put up. There's more information on there. There's a media page on the website that I hope that many of you will go to and will look at some very basic questions. There's some frequently asked questions on the website. There's a Twitter, X I guess they call it these days, page that will be beginning now in the next few days to roll out information about confirmed speakers and confirmed high-level attendees. There will be an Instagram page. Africa is ready and Nigeria is ready to welcome the world to the first high-level ministerial on AMR on the continent. And we are excited to welcome you all, and we hope that you all are preparing to join us. That is very much my intro into this. This meeting is focused on identifying new solutions for how we all, and I don't mean just the Quad community. It is not a health-focused meeting. I want to say that outright, that this will be different in that it is not going to just focus on human health, because typically we have One Health meetings and you just hear about human health. You hear from ministers of health, but what about the ministers of agriculture? What about the ministers of livestock? What about the ministers of environment? What about the ministers of finance? Because if we don't have money, how are we going to get any of this work done? There is a proverb in my language, Yoruba, which says "Owoni kekeyi rere," that it is money and funding that enables good works to be done. It is the funding that is the bike on which good works ride. So we have to involve those who are speaking the economics, who are talking about the return on investment, on investing in prevention of AMR. We have to speak to the agriculturalists about how they are giving antibiotics and how they are looking after the animals and the fish that we ingest and we eat. We have to speak to the agri-foods systems people about how on earth are we looking after our soils. We have to speak to water and sanitation. So as you see, this is a broad-based conference that we're looking at a glance, to talk very briefly about the actual content of the meeting itself, the sort of structure. It is over 3 days. It is from the 28th of June this year, I believe it is. If you look on the TikTok on the website, I don't know if somebody looks and can put it in the chat, it will probably give me some palpitations, but I know it is less than 90 days because we had a 90-day alert go out just a few days ago. So it is from the 28th of June to the 30th of June 2026. It will be held in Abuja, Nigeria at the Transcorp Hilton Hotel. We have booked the several rooms out of the hotel. The entire hotel will be being utilized for the conference as we have side events going, panels going, and main plenary sessions. The 28th will be the non-state actor day. I already see some people asking in the chat, and they're saying, how can one attend in person? Go to the website and see how that can be done. Room is running out fast. Registrations are filling up, and also for those coming from overseas, hotel rooms in Abuja, some of you will know, are relatively limited, so people are encouraged to get online and to book. There's a travel portal that gives advice on the website. The 28th is the non-state actor day, in which we'll be partnering with the Quadripartite, with MSPP and many other partners to bring together non-state actors, civil society organizations, the people we are here to serve. I am a special envoy for AMR. I do not work for the government of Nigeria per se, but I'm appointed by the government of Nigeria to ensure that this topic, not just this conference, but that this topic is brought to the highest level of the political agenda. The conference is under the patronage of President Bola Ahmed.
We cannot hear you. Dr. Yodi, we cannot hear you. I think there is some connectivity problem. I think
I think so.
Yeah, Dr. Yodi needs to reconnect, I think, again, because we'll just wait for her to come back.
Sure. checking if someone from her team is around on the call.
I don't know. I don't think so. I'm not very sure of that also. And Dr. Jede is not there also till now, I think. Jede. But I'm sure she'll be back,
Sure.
Yes,
I think
yes. We can wait for some time, yes. Then we'll take up the questions, yes. Internet is always a problem, Dr. Niyamazi, particularly in our countries, and we never know when.
Indeed.
Yes.
Yeah, indeed.
Sorry about that. Lost for a minute. We had a little technical glitch, but I hope you took the opportunity all to check the website and to begin to look into some of the things that I spoke about. What did I miss? Tell me.
We were just friendly exchanging and saying that we have to wait for you.
Okay, excellent. Well, where did you lose me? I was telling you all about the structure of the meeting and that it will be a 3-day meeting from the 28th to the 30th. The 28th is Non-State Actor Day, civil society, media organizations. You're all welcome to get very actively involved. The 29th will be the first day of the main ministerial, in which we're expecting ministers of health from over 100 countries around the world. We have invited ministers of agriculture, ministers of health, ministers of environment, livestock, and also some ministers of finance from all over the world. We're receiving confirmations as we speak, and last week I had the privilege and the pleasure of being at the One Health conference in Lyon, France, hosted by President Macron, at which many of the people who were present there at highest levels have confirmed their attendance. So the 29th will be the main ministerial plenary panel day, and the 30th will be the sort of final day of country statements, looking into the outcome document, adopting and reaching some sort of agreement on whatever that outcome statement will be, presenting that to the whole world, and also the handover ceremony. Also on that third day, the 30th, the MSPP, of which many people of you are members of, will hold their general assembly or plenary session in the afternoon after the closing, and there will be about 6 civil society panels on day 3. So that is the broad structure of the meeting. All of this will be happening here in Abuja, Nigeria. I'm going to stop for a moment and then go to more technical aspects, if there are no immediate questions.
Thank you, Dr. Yode, and thank you for such an informative sharing in such simple words about AMR. Dr. Yode, is Dr. Jide coming? Do you have any idea? Will he be there?
He is traveling at the moment, and he's supposed to be joining us. So at the moment, he is unable to reach him. So I take it he has not landed. So let's just keep going. And he'll join us as he can.
Okay, all right. So we now open for questions and answers. Participants, please continue sharing your questions in the chat box, and only as many questions relevant to the topic of today's briefing would be taken up as time permits. We already have a few questions with us, which had been sent by the journalists earlier. So the first question is that from Nigeria's experience, how critical is coordinated action across agriculture, livestock, animal health, environment, and human health for effective AMR prevention and control? And how is this integrated multidisciplinary approach reflected in the ministerial meeting?
Thank you, Shoba. That's an excellent question. And the simple answer to it is that it is incredibly integrated. We have a Ministerial Advisory Council in Nigeria that comprises the ministers of all sectors, and the Ministerial Advisory Council that I also sit on. It is chaired at the moment by the Minister of Health, Coordinating Minister of Health, Mohammed Pate. So that is number one. There is also at the next level, there is chaired by the Director General, Dr. Jide Idris of the NCD a One Health committee of the directors of all, these sort of active implementers, as it were, of all of those ministries and parastatals. So it is very, very much integrated within Nigeria. We've been doing this way before the conference was awarded to Nigeria. So this is not something that has come along because of the 5th high-level ministerial. Nigeria has been involved in this integrated approach for a while because, as I said earlier, it is important that all sectors speak to one another and work in concert with one another. So for the ministerial, this Ministerial Advisory Council is the sort of overall governing body, for instance, of this ministerial conference, and all of those ministers are actively involved, which is why we're inviting their counterparts from all over the world. It is critical, and I mean, I don't need to say any more.
Okay. Thank you. How do you see this high-level ministerial meeting contributing in practical terms to controlling AMR on the ground, particularly in countries facing health system and resource constraints?
That is another great question. I mean, I cannot, as an individual, say how it will contribute to controlling AMR on the ground, but that is our intent. And that is why, what you earlier said, Shoba, about, the underserved and basically talking about high burden countries is very much on our minds, and AMR has been seen very much from the lens of the high-income countries, very much from the lens almost of the Western countries, very much from the lens of we wish to develop new sophisticated drugs to treat illnesses. But it is being looked at from the infection prevention and control, from the prevention aspect, from looking at our countries. Mine, I assume you also come from the sort of Asian continent, I would imagine, from Namaste, from India, where many of our people don't have access to medicines. They don't have access to the basics of antibiotics. And they are dying for want of access alone. They are dying because there are more antibiotics in animals being fed to our agriculture sectors. There are more antibiotics in our food systems than there are available for human beings. So we have to ensure that these global commitments, as Jean-Pierre mentioned earlier, the UNGA declarations, the various declarations, that is why we said these things need to be turned into not just action, but need to be turned into local action. Local action is critical for turning this into what our communities will begin to feel. Meetings are all well and fine, but if you, the media, don't hold us accountable to local action, then they're all a waste of time. Over.
Thank you. Another question which we have is, one recurring concern after global AMR meetings is the follow-through. As the host country, how does Nigeria envisage ensuring that commitments made at this ministerial meeting translate into concrete action by governments after the meeting?
Again, I think I answered that in the last question, and I pretty much said the same thing. I am not the biggest fan of meetings. Anybody who knows me well knows that I am not the biggest fan of big meetings. I am very much an action-oriented person. I tell people that I'm a Nike girl, just do it. Just do it. Instead of all the talk, how do we see actual action on the ground? Now, Nigeria cannot, all countries are sovereign, and Nigeria cannot force sovereign states into action on the ground. But what we do hope is this will go beyond the rhetoric of the past. It will go beyond just bringing it to the highest level of political attention, because it is there. There is a global leaders group on AMR now that used to be headed by Mia Motley from Barbados, and many other high-level people who have taken on this issue. So it is time for the people at the grassroots to understand. For me, one of the things that the media can do, if I can have an ask to you all, is help us to translate what is AMR into language that people on the ground can understand. It is to help us to teach people that when you have a fever, for instance, you have a headache and you have a little fever, do not go to your local or you go to your local chemist and they give you 5 antibiotics and tell you, for instance, in Nigeria, you have typhoid plus malaria. Question it and tell the pharmacist or the chemist that, do you know about AMR? Do you understand that this is contributing to AMR? This is a dialogue between us and you journalists, and you also are a big part in helping us make sure that countries commit to what they say they're going to do.
Thank you, Yodi. Another question. Financing remains one of the biggest barriers to implementing national AMR action plans, especially again in low and middle income countries. Will this ministerial meeting help mobilize political commitment or resources for implementation? And what role does Nigeria see for itself in this regard?
I've said that again in my original introduction, that we see this as a meeting that will also speak to, what is the return on investment. For instance, we're working with colleagues from the OECD and various organizations. I met with them just the other day in Lyon, talking about research into what is the return on investment of investing $1. Did you know that if you invest $1 in AMR prevention, it's a $11 times return on investment, 11 times. So these are the sort of analyses that we're bringing to the table, and that's why I say that this is going to be a meeting, a high level, unlike those in the past. We're not just going to be talking about, X number of people die of AMR. We're not fear mongering. We're talking truly about solutions. So finances will very much be on the table. How do we finance? How do we finance prevention? And by the way, when I say finance prevention, I don't mean or finance AMR, I don't mean put trillions of dollars into developing a whole new antibiotic. It can be as simple as water systems. It can be as simple as sanitation systems. It can be as simple as surveillance. It is not huge amounts of money, for instance, that our low and middle income countries necessarily need. It is strategic investments that our countries and our communities need. The high-income countries of the world as well, and this resource-constrained world that we now live in, are beginning themselves to realize more and more that you need to get more return on every dollar that you spend, and that is something Abuja will be spending a lot of time talking about and hopefully putting into action.
Thank you. Jode Sella Woldai from Ministry of Health Germany wants to know if there is already a conference program available and what are the rules on registration.
Do please go to the website. There's a hello, Sella, lovely to talk to you, and we're very, very thrilled that you're engaged. Like I've said, you're from Ministry of Health, but do please also speak to your colleagues from Ministry of Agriculture and Environment. We have actually already had a response from the Ministry of, I believe some of the team are online. We've had a response, I believe, from the Environment Minister of Germany already, and we're in close contact with your ambassador, Annette Gunther, in Abuja, Nigeria. The registration details are online. Ministers have received invitations. The agenda will be ready approximately a month before the meeting. As I'm sure you all understand, the agenda is formed and put together. It is currently in process, but it is formed and it's put together as confirmations of attendees are received. So once we know which high-level ministers are coming in, the non-state actor day agenda is being influenced by the interactions with MSPP and the Quadripartite, and also with the abstracts. There was a call for abstracts. We've received well over 100 to 200, I believe, abstracts that are currently undergoing a double peer review process, and they're being reviewed by an esteemed group of reviewers. And if you go to the website, you will see their names on, some who've been with the Lancet, with the British Medical Journal, who are from some from academic institutions, and some young Nigerians also in academic institutions in the diaspora and at home. So there's peer review ongoing. Abstracts closed, I believe, about 10 days ago. We're currently receiving side event submissions, and those are also being received on the website. I believe those close on the 20th of this month, April. And I will give you a little secret though. Shh, don't tell anybody. But the secret is there might be a late breaker for abstracts. There might be another chance to apply to send in abstracts. So once we've been through the first round, and if there's any space, shh, there might be time still to submit abstracts. But so far we have, to give you a broad view, the colleague from Germany, we have about 16 to 18 side events, 20 panels, and about 7 keynote plenary sessions across the conference.
Thank you for letting out the secret, Yodi. And there has been a question from many journalists that following today's global media briefing, will there be further opportunities for journalists to engage with Nigerian officials or other participating governments during or after the ministerial meeting?
Could you repeat that question, please?
Will there be further opportunities for journalists to engage with Nigerian officials or other participating government officials during or after the ministerial meeting?
Absolutely, absolutely. There will be press events. There is a media registration page, I believe, which one of the colleagues will put up in the chat. But absolutely, we hope to have a press conference immediately after the conference. During the 3 days of the conference, there will be press corners for media to engage with the various ministers. As I say, we're expecting well over, I'm really getting nervous because we're expecting well over 100 ministers at this moment. We have the DGs of WHO, FAO, UNEP, WOA, the Quadripartite Organizations, including DG WTO, DG WIPO, the trilateral organizations, and many others who are confirmed already to be at the ministerial summit. We have also interest, and we're speaking with presidents of Ghana, presidents of Botswana, a couple of presidents, particularly within the African continent, our brother and presidents in the African continent, who we're hoping will join us as President Tinubu hosts a welcome dinner the night before the conference. So there will be plenty of opportunity for media to engage, and there'll be lots of media gaggles. We hope to see you all there.
Thank you, Yodi. Just a moment. There is a question for Dr. Niamazi. Two journalists, they want to know, one from South Africa, another from Pakistan, wants to know just a moment, let me get the question. What progress has been made since the previous ministerial conference on AMR? And what are the remaining challenges? And again, the other question was similar. What has been the importance of the past high-level meetings in terms of impact?
Thank you so much. Great questions. And thank you to colleagues who have requested those information. I would say from the Jeddah to Nigeria, it would be really hard to measure the impact just in one single year or 2 years maximum. That's not realistic. But I would say that even if you start from the way that Nigeria is organizing this meeting, it's well informed by the previous ministerial conferences. And one way of doing that, if you recall, in Jeddah, we agreed on a troika mechanism. The way that we keep continuity from one meeting to another, because we agreed with you that there was that gap, that you had one ministerial conference that happened and then you have another one, and there was no connection between them. Now, a way of bridging that gap included to create a troika, which is the past host, the current host, and the future host. And Nigeria is already working closely with the troika countries to make sure that the past discussions do inform the current discussion and then also will be taken forward for the future. Another important, I would say, measurable result is that the way this meeting have been growing over the years, when you go back to 2014, when we had the first ministerial conference and the second one, 2019, they were predominantly being health really ministers attending those. And also a few countries were attending these, especially the countries that were attending them were mostly European countries. But now we see the focus changing from the health to One Health, having more ministerial representation from the agri-food, environment, animal health, of course, plus the human health. That's really becoming the norm, and that's very interesting because most of the issues being discussed, you'll see it's not only about human health. When we talk about prevention, we're talking about prevention strategies across all the sectors, not just only about human health. That's another big, to me, result that we can see. Now, third element, which is the most critical one that we need to see more results now happening, is that, we started to now really get to understand the estimates of the death and also the economic toll of the AMR. And from 2024 political declaration, we have a target. The member states agreed on a 10% reduction of the drug resistance related death by 2030. So coming from 4.9 million that were recorded in 2019, to reduce that by 10% by 2030. Now, we have from the evidence, we have come to know what works, and some of the colleagues are online today, they can speak eloquently about this. So they are really simple, I would call them simple, but they're not simple, but they are really easily implementable strategies around prevention, IPC, washing hands, simple, I would say, strategies that do not cost much, that could really bring us there. That could bring us to the 10% reduction. Then plus the access to essential antimicrobials. So these are the things that we believe countries and governments can do, of course, alongside all of us, the people, the community, and then we can really achieve the target of reduction of the 10% by 2030. It's pretty soon, 2030, but also we are not asking people to do the most I would say, cost-intensive and resource-intensive interventions, just the practical ones around prevention and appropriate use of antimicrobials can also take us to the target that has been discussed. And I think that's where Nigeria is taking us in the next conference to really discuss this very well-known intervention that work, and then see how we can scale them up and then meet the targets that were set by the previous meeting. Thank you for the questions again.
Thank you.
Can I make a quick comment as well?
Yes, please, please. Yes,
Jean-Pierre
please.
just said. Absolutely.
Please.
I mean, on what he just spoke about the Troika, I want you to know the Troika was one of the key sort of outcomes of the Jeddah commitment, the Jeddah Declaration document. And we have initiated that in last summer, late May, June last year. I went to Riyadh, Saudi Arabia, Kingdom of Saudi Arabia, and we launched the Troika. So we have already seen some movement forward. That continuity, as the political dimensions of a ministerial meeting include continuity and accountability, include the political leadership and representation, include technical leadership and delivery. And you're now speaking to the issue of continuity and accountability. I've seen many questions around that. The Troika was launched mid last year. At that point included Oman, Saudi Arabia, and Nigeria. And the leadership of it was handed over to Nigeria last June, July, as we began to prepare for this meeting. So the continuity and the conversations are now including those countries at a core level. So as you talk about sort of the outcome documents, what are we planning moving forward? I was recently together with Minister Pate of Nigeria, again in Riyadh, Saudi Arabia, meeting with their government officials and various representatives there from across their whole spectrum to talk about the way forward with this conference. So it is definitely a continued process. There is also a country that will be joining the Troika, which will be the next country for the ministerial. Now that's secret. I'm not going to tell you today. Shh. But the next troika, as you know, the before, the current, and the next, that is how it starts. Unfortunately, of course, because with Jeddah, that was the first country to introduce it. We started with the 2 countries ago, the last country and us. And by the time we get to Abuja, we will have the troika mechanism, just like it is in the G7, just like it is in the G20, fully institutionalized. And that is the word, it's the institutionalization of this process. It's the institutionalization of the governance of the AMR mechanism across countries, across regions, and across the entire globe. One thing I also want to say is Chidera, somebody called Chidera has put in a great question about NAPs, the National Action Plans,
Yes.
and how do we that is, I just want to acknowledge that is a really critical question, because, and it speaks to coordination. I mean, I know, for instance, I'm not a technical AMR person within Nigeria. I did study medicine. My daughter often tells me that she, every time I try to treat her for malaria or something, that she hasn't seen my certificate. She thinks I'm not a proper doctor. But but I promise you I did. I studied medicine at the University of Ibadan, and our preeminent medical school in Africa, those of you who are going to complain. The issue that we're seeing here in Nigeria is NAP1, NAPS2, the coordination of these mechanisms that are coming from, with external funding, a key link to that previous question about resources. External funding, there was funding provided to the NCDC or not to NCDC, to Nigeria, in quote, for NAPS, that went to various organizations and various labs and various parts of the country that the central government, the National Center for Disease Control, was not informed about. There was very little coordination. So, there is interest coming in from outside countries, working within our countries, but we are not given that, we are not the repository, and we're not able to coordinate. And these are some of the things that must change. Many of you would have heard about the Accra reset and talking about the different ways of health sovereignty and how funding is done, and how global health and global development works. We cannot be the recipient of funds that are meant to benefit somebody else's data set. We have to be the recipient of, or we have to give our own funds internally, domestic resource mobilization, so that we have control of our own data and that we understand what is truly going on. That's for Chidera. Faith, you are also absolutely right, and I agree with you. It is not for me to determine how media, form or get the funding to get to these meetings. But like I said at the beginning, without you, we cannot do anything. Over to you, Shobha.
Thank you. So I was about to ask that question. Would there be funding for health journalists willing to travel to cover this event? But
look, I know that there must be different organizations of Quadripartite. I'm sure that's more a question for them. The Quadripartite, this event, Nigeria, like the rest of the world, there's a resource constrained environment.
Yes.
We're not, it's an event that is being managed within the world that we live in. And right. So, I would like to say that, yes, those of you who would like to come, do please register. I know that many of our partners and others, somebody asked about civil society organizations. I believe MSPP is working with us strategically to coordinate civil society partner organizations, perhaps reach out to them and find out some of the mechanisms, and stay engaged with the website. Some of those people who submitted abstracts might be selected to come, and there may be funding for those people to attend. But as a rule, as a blanket rule, I cannot say we're funding media.
All right. Thank you, Dr. Alakija. Then there is one question about AMR in animals, that there have been growing concerns about the issue in animals too. Are there real concerns here, and what is the global committee in Nigeria doing around this? Perhaps it is referring to the One Health approach.
It is exactly referring to the One Health approach, and AMR, I think I mentioned it at the beginning. This is why we have, ministers of agriculture present. I know that there's moves in countries that are big sort of ag producers like Brazil and other large countries to limit the use of antimicrobials in animals to begin to address that. We have chief veterinary officers that are working with us on the Ministerial Advisory Council on this. It is very, very much top of agenda, top of mind for us. And you are absolutely correct. We cannot leave animals, fish, or the environment, soil. There is antimicrobials now in soil, and we cannot leave any behind.
Yes, thank you. And I just wanted to share, Dr. Alakeji, there was a case in India has happened recently that a domestic cat had tuberculosis. That is the first case of tuberculosis in a cat.
Wow.
And that was a pet cat. So how easily, again, that is why the One Health approach is so very important. How easily it can be transferred from animal, any disease from, like so many diseases from animal to human being. Bovine TB we had heard of, but I had never heard of tuberculosis in a cat.
Yes, and that is very dangerous because
Yes,
people, people are very fond of kissing and cuddling their cats. So that is incredibly dangerous. I mean, we're seeing it in animals. We're seeing fungal outbreaks even in, there's some research that will be presented about Nigeria, fungal outbreaks in Nigeria that are linked to antimicrobial resistance. But it is an issue that is not just for discussion, but is for immediate action. I think, Shoba, what you've just said tells us that.
Yes,
Go
yes,
ahead.
sure. Then there is one question on financing again and multi-sectoral action, that considering the involvement of multiple sectors, health, agriculture, environment, livestock, and how will the conference address the persistent challenge of sustainable financing and accountability across these many sectors to ensure effective One Health implementation?
I believe I've already answered that question. I have said that there is very much, we typically go to these meetings and speak about hospitals and health. Health and humans. We're already, even in this presser, we're talking about, domestic cats and tuberculosis. For me, that's already a success. Where, as you say, we talked about bovine TB. We have to talk about the financing, and we have scheduled we have sessions scheduled around financing and the need for sustainable financing. Domestic resource mobilization is very much the mantra of my coordinating minister in Nigeria, very much that we from low and middle income countries have to start learning how to mobilize finances ourselves. I, for many, many years, have been talking about the Abuja Declaration of Health, where Africa's ministers promised 15% of spend in health. This is the moment for that. This is the moment, and this is why we're looking at leaders that are leading meetings like the Accra Reset, etc., to be present, to begin to talk to us about how do we get the funding, how do we bring the funding to the table to ensure that these are not just moments in time. We can't just have this meeting and then be looking ahead to 2029 high-level UNGA meeting. No, the time for action is now.
Thank you.
Faith again makes a very good point about antibiotics being too easy to access, and those again, these are the prevention issues that we're speaking about that are critical.
Yes.
Over.
And I just wanted to add that there is the issue of access and excess, both. Like somewhere they are not accessible, and somewhere there is too much of misuse and overuse of it. So that needs to be looked into, I think. There is one question that how can countries like South Sudan with fragmented health systems and continued conflicts, and that applies to other countries, we are living in a war-torn world these days. How do they contribute to the fight against AMR, and what practical lessons can South Sudan learn from Nigeria health system?
Thank you very much, my brother, sister from South Sudan. Thank you for your question. We actually are in contact with your government. We have had representation from the government of South Sudan, reaching out about the meeting, and I'm hopeful that we can have some, South to South collaboration and cooperation between our countries, not just South Sudan, but across not just Africa, but South America will be present in big numbers. I recently met with senior officials from Uruguay, the Caribbean. We're expecting ministers of agriculture from Caribbean countries. So I'm hoping there'll be an opportunity for South to South learning across not just Africa, but other countries.
Thank you. Dr. Yodi, do we wait for Dr. Jedi?
No, we just keep going.
No.
We just keep going.
Okay. Okay. So I think we have taken up most of the questions which were there. So can we come to the close of today's global media briefing? I think we have taken up almost all the questions which were there in the chat box.
Well, if we have, let me just say something, that the ministerial meeting itself is just a moment in time.
Yes.
The larger objective is to advance and to sustain global efforts to curb AMR, antimicrobial resistance, within Nigeria, across Africa, and globally. This is what is critical, and this is what is needed. To ensure this continuity, as I said to you earlier, engagement with Troika countries is continuing and is strengthening following initial meetings. We really have remained in close and proactive contact with the Quadripartite, with many of the partners, the GLG, and across the world. This is a global effort. This is a global meeting. It is your meeting. It is not Nigeria's meeting. I want to be clear about this. Nigeria is merely the host, but it is a meeting for the entire world. Even with my colleagues in Nigeria, within Nigeria, we say that we are welcoming the world. We are here to host you, but the issues to be discussed will not just be Nigerian issues. Nigeria hosts the world. If you think about the Olympics, is hosted, say, in France. France participates, but they are the host. We're not controlling it. We are here to welcome you with our warm culture. We're here to show you our vibrant youth who are going to be very much a part of this meeting, because over 70% of our population in Africa, Nigeria, and many other countries that are, high burden countries in this regard are young people. So we're not just going to have 60 and 70-year-olds on panels talking, but we're going to have exciting, young people and young interventions, and the voice of Nigerian youth, the voice of youth from across the world that will be heard. The Nigerian initiatives are our own homegrown initiatives that will come out of the conference will, of course, be for Nigeria, but we are here to hear what the world wants to see and what the world is going to do in terms of action going forward.
Okay. There was one question, Yodi, that will the meetings, can they be attended online? Will they be hybrid in nature? Or
the ministerial is an in-person meeting only. There may be some sessions that might be accessible online, but as a rule, it is an in-person meeting. It's a ministerial meeting and in-person.
Okay. Thank you. So we now come to the close of today's global
Shoba, if I may, just
sorry. Yes, please.
Faith Kariuki had put a question in the chat, and I was going to reply to it, but I deleted it. Just send an apology from me. I think, but Yoda, I think, commented on it. It was about their drugs are accessible, especially in the African continent, but not always appropriately used. I think was mentioned by Yodi in her response.
Yes. Thank you. I request the participants to please stay on for a few more minutes for the no less exciting part 2 of today's session. I would love the speakers to be there also if they have some time, because we are going to announce and launch the 3rd edition of the Global AMR Media Awards. So Yode and Dr. Niyamazi. Dr. Yode and Dr. Niyamazi, you're most welcome to stay on, please. So,
well, I
but,
unfortunately will have to leave you, but I congratulate the recipients, and I hope
no,
part of the prize is
no.
it's not you're not announcing winners.
No, it's just we are opening the awards. We will announce them just ahead of the WOW week in November.
Okay.
That is what we do. So we will invite you then again, and we expect you to be there, Dr. Yode. Yes.
Thank you so much, Shobha. It's
Thank you.
great to
Thank you.
been with you all. Thank you for your time. Engage with the website, retweet on, or whatever they call it, on that that app X. We have that going up, and that's in the chat. There's an Instagram page.
Yes.
Information on speakers and on confirmed guests will begin to go out. Thank you for your time. Over and out.
Thank
Goodbye.
you. Before moving on to the second part, my sincere thanks to each of the speakers for not only letting us know more about the most important intergovernmental ministerial meeting on AMR happening later this year, but also responding to the questions as much as possible and in such a beautiful way. Thanks to the participants for their active participation. Our special gratitude to World Health Organization and the Quadripartite Joint Secretariat on AMR for the support and guidance in organizing today's briefing. And many thanks to my dear friend, Dr. Diriba Moisesa, for all his guidance. Now is the perfect segue to transition to the second part of today's session. First, let us listen to a message from Gamma Ambassador and a famous German film and TV actress and a show host, Annabelle Manding. Annabelle has supported communities living with HIV since over 2 decades and stands up for preventing AMR since past few years with Gamma. She was busy shooting for a film, so she couldn't come online. She has sent a video message.
As ambassador of Global AMR Media Alliance, Gamma, to prevent antimicrobial resistance and help save the medicines that protect us, I would like to congratulate Ojoma Akor, senior journalist from Nigeria, for bringing together Nigerian journalists as part of Nigeria country chapter of Gamma, now called Nigeria AMR Media Alliance, or NAMA. Thank you, NAMA, and other national and sub-national chapters of Gamma, and other journalists for actively reporting on AMR. Media engagement on AMR is one of the strong pillars for addressing the challenge AMR poses to human health, as well as animal health and livestock, food and agriculture, and our environment. It gives me great honor to launch the 3rd edition of Global AMR Media Awards 2026. I'm looking forward to hosting the awards ceremony before the World AMR Awareness Week in November 2026. Till then, best of wishes.
Thank you, Annabelle. Now here comes the 3rd edition of the Global AMR Media Awards 2026. But before that, I'm happy to inform you all that Gamma now has some country and state chapters too. The 3rd edition of Global AMR Media Awards would have 1st, 2nd, and 3rd prizes, as well as special mention prizes in each of the 4 regions: African region, Asia Pacific region, Americas, and the European region. In addition, we have a special category for those reporting around the 5th high-level ministerial meeting on AMR. We also have national and sub-national awards. Let us know more about them now. As the 5th high-level ministerial meeting on AMR is taking place in Nigeria, let us first listen to the chair of Nigeria AMR Media Alliance and board member of Gamma, Ojoma Akor, whom Annabelle mentioned in her video message. Thanks, Ojoma, for joining hands with Gamma and other chapters in organizing AMR dialogue session on AMR under gender lens last month and today's briefing. Can you please tell us about the special award category and more about the inaugural edition of Nigeria AMR Media Awards 2026? Over to you. Yes, Ojoma.
You are on mute. She's muted, yeah.
Ojoma, are you there?
Yeah, thanks,
Yes,
Shoba.
yes, yes.
Yeah, so mentioned earlier, I am pleased to inform you all of the Nigerian chapter of GAMA. It is called the Nigerian AMR Media Alliance. Nigerian journalists came together to establish it some months ago, and we comprise journalists from human health, agriculture, and environment, and across all platforms too. At the last count, we are itching towards 100 journalists. We are committed to creating awareness around AMR, in the science, doing investigative stories, and advancing the cause of preventing AMR in Nigeria and across the globe. We are very committed to covering the 5th Ministerial Conference on AMR that is coming up. So we've collaborated with GAMA to do the dialogue on AMR to gender lens, and we have also collaborated with GAMA today for this briefing ahead of the meeting. So GAMA has been having annual awards on AMR, and I'm excited to announce the inaugural edition of the Nigerian AMR Media Award. There's going to be first prize, second prize, third prize, as well as special mention prizes. So we are going to see a lot of stories, insightful stories coming out of Nigeria with recognitions for all the journalists. Thank you all.
Thank you, Ojoma. Now we move to Nepal. The Nepal AMR Media Alliance, along with GAMA, has organized several media engagement sessions over the years. Last year, at the World AMR Awareness Week 2025 on 24th November, with help from Ministry of Health and Population of Government of Nepal and WHO Nepal, Nepal AMR Media Alliance and GAMA had successfully organized a powerful session on AMR, announcing the first inaugural AMR Media Awards. I would request Kalpana Acharya, Editor-in-Chief of Health TV Online Nepal and Chairperson of Nepal AMR Media Alliance, as well as a board member of GAMA, to announce the 2026 Nepal AMR Media Awards categories. Over to you, Kalpana.
Thank you, Soba. Please forgive me, my voice is not good today.
No, it doesn't matter at all.
Namaste, everyone. Thank you so much for this great opportunity. I think as journalists, we are not just storytellers. We are agents of change. I think so. In Nepal, journalists came together nearby 4 years ago with a shared commitments to raise awareness on AMR through responsible and impactful recognition and reporting through GAMA. This small effort has now become a growing movement. Last year, we successfully organized, Soba, a South Asian level media workshop on AMR in partnership with Ministry of Health and Population here in Nepal and WHO Nepal, including other partners organizations. This workshop created cross-border collaborations and stronger regional understanding of AMR challenge. I think so. What are we doing this year is planning for another regional conference here in Nepal, like previous year, launching a special AMR Media Award for Nepali journalists to recognize and motivate them to write on AMR. I believe this type of recognition encourages them. And we have, as Soba mentioned, we have separate Nepal GAMA chapter. Besides this, we are engaged on dialogue and policy engagement too. Last November, we organized AMR dialogue session, bringing government officials, health professionals, and journalist friends. This created a bridge between policy and public commitments and communication. I believe together our voices can influence behavior policy and timely save lives. So I request all to let's continue to inform public And another I want to add, this GAMA Nepal chapter will announce this year, actually announced already. We announced around $200 award for best journalist who write on AMR. Even though we have 3 category and a special award, but we have sources because we collaborate with Government of Nepal, Ministry of Health and Population, so that we can give this award with amount.
Okay.
I believe it encourages many journalists to apply and write on AMR.
Thank you.
So we are trying to do our best in Nepal. Thank you, Sobha. Thank you.
Thank you for all your support and help, Kalpana. Now coming to India, the first inaugural India AMR Media Awards were organized in 2025. Let me invite award-winning senior journalist Lata Mishra, who leads the India AMR Media Alliance. Lata has worked with the Times of India since almost 2 decades now and is currently senior assistant editor as well as national health reporter. She was elected as secretary of Mumbai Press Club and has served with a distinguished record there. Welcome, Lata. Tell us something about the award categories of the second edition of India AMR Media Awards 2026. Over to you, Lata.
Lata's internet connection dropped off, I think. So
okay. All right. So now we come to a sub-national chapter. In January 2026, React Asia Pacific and GAMA had launched Kerala AMR Media Alliance at Kerala Working Journalists Association Press Club in Kerala's capital city of Thiruvananthapuram. We have with us today my friend Dr. Ijya Singh, a noted AMR advocate, to announce the awards category for the inaugural Kerala AMR Media Awards in 2026. Welcome, Ijya.
Thank you. It's my great pleasure to be here today to be a part of this discussion. And as a part of React Network, I would like to mention that React has made an important contribution to the global AMR response through research, advocacy, and partnerships. And in Asia Pacific region, this has helped to build stronger collaboration and better awareness. And we have been also working closely with media in Indonesia for many years, supporting better understanding and reporting on AMR. And last year, as Shobha Madam mentioned, we organized a national AMR media workshop, and this has led to the launch of India AMR National Alliance. And earlier this year, React Asia Pacific, we partnered with Global AMR Media Alliance to launch the first sub-national chapter, that is Kerala State Chapter of AMR Media Alliance. This brings AMR conversations closer to communities and strengthen local media involvement. As we all know, media plays an important role in making complex issues simple. Good reporting can influence public behavior as well as policy. So engaging media is essential in fight against AMR. And today I'm very happy to share an exciting announcement on the behalf of Kerala AMR Media Alliance. Today, we are launching the Kerala AMR Media Awards 2026, the first edition. These awards will recognize the best reporting on AMR, including first, second, and third prize, along with special mentions. The award will be presented ahead of World AMR Awareness Week 2026. The link is there in the chat box. Thank you. Thank you, ma'am.
Thank you, Ijya. Thank you very much. Now, with increasing engagement of people with lived experiences of AMR, a foundational shift in AMR response is taking place globally as well as locally. The WHO Task Force of AMR Survivors has played a phenomenal role in humanizing AMR response. Its campaign, AMR is visible, I am not, is indeed a powerful crusade to impact change. This year, GAMA, along with the AMR narrative, has added a new Put People First AMR Media Award category to shine a spotlight on media that is featuring voices of AMR survivors in a rights-based manner. Let us listen to AMR survivor Vanessa Carter. Vanessa is the founder head of the AMR narrative, and she also serves as chairperson of the WHO Task Force of AMR Survivors. Let us listen to her.
Hello, everybody. My name is Vanessa Carter, and I am so sorry that I'm not there in person, but I'm so pleased. I'm always so pleased to see that there is some sort of media engagement around antimicrobial resistance, or AMR, because I'm a patient survivor of it. And one of the biggest things for me was the fact that I didn't understand what it was. So I think that the media have a huge role to play in this. Had I known, perhaps I would have had a different outcome in terms of my case. And a lot of people do die from this. A lot of people do die from AMR. And so there's such a huge role to play in terms of making it more understandable for patients and the public. So, first of all, I just want to thank the Nigeria AMR Media Alliance, or NAMA, and its founding chairperson, Ajoma Akor, for co-hosting today's session with the Global AMR Media Alliance, who we've been very proud to work with, Gamma, for the last couple of years, as the charity or patient organization called the AMR Narrative. And all of the chapters, including Nepal, the AMR Media Alliance in Nepal, the India AMR Media Alliance, and subnational chapters like the Kerala AMR Media Alliance, which has been co-hosted with REACT Asia Pacific. It gives me great pleasure to launch the inaugural award category of the third edition of the annual Global AMR Media Awards 2026, co-hosted by Gamma and our patient organization, the AMR Narrative. So the title is Put People First, and this award is so important, because this is what we're doing it for, right? And this category is to shine a spotlight on the media and other journalists like bloggers or social media influencers who report on AMR, and also feature voices of AMR survivors, carers, and members of the public in a rights-based, person-centered, and gender-transformative manner. Humanizing AMR is a very compelling priority, and we look forward to the media playing a role in that, exactly that. So Putting People First, the Putting People First Award category will have a first, second, and third prize, as well as a special mention prize too. And if you ever want to, whatever article that you write, you are welcome to contact me, the AMR Narrative, or some other AMR survivors if you need any further guidance, such as interview requests, because again, this is so important. Whatever you do in the media, you have to center it around what it feels like for people, for patients, for those that have lost their loved ones, for those that have become disabled, and so on. So, I really look forward to the work that you do going forward, and I thank you, Gamma.
Thank you, Vanessa. And Vanessa and the likes of her are a reminder that all of us are at risk of AMR. And in the absence of strong public systems, we might also be contributing to AMR in some way or the other. For example, when we treat our pet or livestock or plants or ourselves without standard definitive diagnosis, AMR is fueled. So we as media must play a more proactive role in ensuring that no one should get infected with a preventable infection in the first place. Standard infection prevention and control, universal vaccination, and water sanitation and hygiene, for instance, must be a reality for everyone. and not just for the privileged few. And if one does contract an infection, there should be systems in place for early and correct diagnosis, proper treatment and care. Thanks to your commitment to the cause of AMR control. Now, the link to apply for the awards, you must have seen, is given in the chat box. Write and shine. Goodbye for now till we meet again. Namaste, and thanks to each one of you for being here today.